Well, good afternoon and welcome to our second webinar created to support the Metro Nashville Public Schools Working with Migraine Program. My name is Phil Belcher and I'm your host for today's session. Today we're going to discuss migraine treatment, well-being, and self-management. So if you're already part of the migraine program, hopefully you've had a chance to review the two videos that detail these topics. During the webinar today, we will briefly review the content of those videos, but our main focus today will be to give participants a chance to hear from our guest expert and to ask questions about migraine treatment and management. For your information, this webinar is being recorded, so those that can't participate today will have a chance to review this valuable information at a later date. And we did have lots of folks that reviewed the first session after it was done live, so that was fantastic. All webinar participants will be muted, and you can submit questions throughout the webinar in the Q&A box, and you can do that anonymously if you like. We encourage you to only submit general questions about migraines. If you have any questions about your personal treatment, we just ask that you please address those with your physician. And finally, to enhance your viewing experience, you can go to the viewing options and place the presentation side by side with the speaker screen. So before we get started, let me introduce you to our facilitators who will guide you through our migraine webinar. First, we have Ms. Kim Gill, who you guys know as your health coach in the Metro Nashville Healthcare Centers. Next, we have Johnsy Holt, who is your staff wellness coordinator at Metro Nashville Public Schools. Also, we are pleased to have Dr. Martha Shepard, who is a family medicine physician and medical director for the Metro Nashville Healthcare Centers. And she's going to lead our Q&A discussion at the end of this presentation. Finally, we are honored to have as our special guest today, Dr. Dane Chetkovich. Dr. Chetkovich is a Margaret and John Warner Professor and Chair of Neurology at Vanderbilt University Medical Center. So please take advantage of this wonderful opportunity to get your questions answered about migraines. So with that introduction, let me hand it over to Ms. Kim Gill, and she's going to lead us in a short welcoming activity. So Kim,
thank you, Phil. Well, hello and welcome everyone. Thank you for being here. To help transition us from a busy work day and to share a little positivity in the world, I would like to invite you to participate in a brief loving kindness meditation. We will silently repeat a phrase throughout this meditation, which I will lead, but you can use any variation of the phrases that feel right for you. Let's get started. So just sit comfortably. You can close your eyes or leave them open. Let your attention settle into your body and start by taking a few deep breaths. Beginning now to wish yourself well by extending words of loving kindness to yourself. Repeat to yourself, may I be safe. May I be happy. May I be healthy. May I live with ease. Next, think of someone who has helped you. Maybe they've helped you directly, such as picking you up when you have fallen. Or maybe you've never met them. This is someone who makes you smile. Visualize them. Say their name to yourself. Get a feel for their presence and offer the phrases, may you be safe. May you be happy. May you be healthy. May you live with ease. Imagine a friend or loved one that is doing well right now. Visualize them or say their name to yourself and offer the phrases. May you be safe. May you be happy. May you be healthy. May you live with ease. Imagine a friend or a loved one who is having difficulty. If someone comes to mind, visualize them and offer the phrases. May you be safe. May you be happy. May you be healthy. May you live with ease. Finally, imagine all people, all creatures, all those in existence near and far, known and unknown. Repeat, may all beings be safe. May all beings be happy. May all beings be healthy. May all beings live with ease. When you are ready, you can open your eyes. All right, Phil.
Thanks, Kim. That's fantastic. That was a great time of self-reflection and just a reminder about sort of the power of positive thoughts and positive thinking. So that was a great exercise. Thank you for that.
Thank you.
So now Kim is going to actually lead us through our first review section on the migraine treatment landscape.
All right, thank you, Phil. Hi, Dr. Chetkovich. So nice to see you again.
Hi.
Let's see, last time we learned about you, you only wear cowboy boots. You've lived in California, Chicago, in the last few years, Tennessee. Anything else you would like to share?
I think you guys know a lot about me already. I guess there might be some new performance. Let's see. Here are my cowboy boots for the day. I don't know if you can see them.
Ah, nice.
Yeah.
I almost wore mine, but I figured I need like 15 minutes to stretch before I could get my leg high enough. So great job getting your leg up there.
Right on.
All right, well, let's get started, shall we?
Yes.
Okay. Well, professional medical organizations that specialize in migraine treatment have published migraine treatment guidelines. These guidelines, used by your medical providers, are evidence-based approaches, so have been studied and proven to be effective. Treatment modalities include acute and preventative medications and other migraine management options, with the overall goal to decrease the frequency and severity of the migraine. So let's get into more details of each category. The first category we will discuss is acute management. Dr. Chetkovich, what are the goals of acute treatment?
Well, really, migraine is terrible when you've got them. A lot of pain, the other symptoms like dizziness and nausea, and really you want to get rid of those symptoms. And it's important to treat those symptoms as soon as you feel a migraine coming on, because the earlier you treat it, the more likely these treatments, these acute treatments, will be successful in getting rid of the pain. And so you want to make sure that treatment works fast and is reliably working. It allows people to function, it removes the pain and the other symptoms. You want to make sure that people can minimize the use of these medications by taking them early in the attack. We also want to make sure that these medicines have low side effects and that patients use other things like relaxation, meditation, getting good sleep, following a good diet in order to limit the need for these medicines.
It's important to start the acute treatments. These are when the intense pain, hopefully before the intense pain. So kind of that pre-migraine area we were talking about, can you use it that early?
Yes, you can, as soon as some people with migraine, as we talked about last time, have an aura, a visual warning sign that they're about to get the head pain within minutes. And so taking those acute medicines very early on is critical.
So what acute medication options are available?
Well, there are a lot. We think about most people use over-the-counter medications, things like aspirin, Tylenol, ibuprofen, naproxen. And when taken early, those can be effective in many people. Some people use caffeine to abort headaches. So they just slug a double espresso, or they may even have caffeine and Tylenol. And there are some over-the-counter products that contain both caffeine and Tylenol. And when these don't work reliably, the primary care provider or a neurologist can recommend other medications that are also good for acutely treating these migraines and stopping the pain. And there are a whole host of them, but one of the most common is sumatriptan, this class of medication called triptans that work specifically on the migraine abnormalities in the brain to get rid of the pain.
So a few options on the market, including over-the-counter, Tylenol, caffeine. If those aren't helping, really work with your provider to help find something that can help you manage your symptoms.
That's good advice.
All right. How about any nausea medicine? Is that helpful?
Sure. Yes. So there are some prescription nausea medications that are useful in acutely treating migraine. Like I said, they're prescription, but we use things like metoclopramide and Zofran. And those can be helpful as well.
Great. Thank you. Next slide. So let's discuss preventative medication treatment. So what exactly is meant by prevention treatment?
Well, prevention treatments are typically medications that are taken on a daily basis, not to acutely treat the head pain, but rather to prevent the migraine attack. And these are medications that reduce the severity of the attack when you get them and reduce the frequency with which you get attacks. And in some cases, they can totally eliminate headaches, to prevent you from having headaches. And there are a few over-the-counter medications that are safe and some people believe effective in preventing headaches. And those are things like riboflavin, a vitamin, and magnesium, a salt, so those can be helpful. Most prevention medications that we know to be effective, that have been tested and reported in the medical literature over many decades, there are a whole host of them. Some of them are blood pressure medicines. So these are almost all of them are medicines that were created to treat something else, but we found that when they're taken regularly, they can prevent migraines from coming on. And so certain blood pressure medicines, certain antidepressants, certain anti-seizure medications, and more recently, there is a new category of medications that can prevent migraine that was developed specifically for migraine. And these are some new medications that are on the market that you can talk to your doctors about. They work by blocking the activity of a peptide that's released and is a part of the migraine mechanism. So those are some things. And then there are other preventions as well, like Botox. So who'd have thought about it, but relaxing the muscles of the face and the neck can actually very clearly reduces the frequency of migraines in some patients.
Yeah, who would have thought nice Botox, having no lines and no expression, and can reduce your migraine frequency?
Yeah, the way that we give it is not for the lines. It's given directly into the muscle, so it's a little bit different than if you'd get it for the crow's feet or whatever. But it works.
It works. All right. Well, who should be considered for these selection of medications?
So we typically, all medications, over-the-counter medications, that I've mentioned, the magnesium can have side effects, but talk to your doctor about that. But all prescription medicines can have side effects, and they're prescribed because of that risk of inadvertently causing problems. So we tend to reserve these prescription medications for people with migraine whose lives are negatively impacted. If they're missing work, if they're having difficulty taking care of their family, or if they're just miserable, they come and they say, the acute medicines aren't working. I'm having such frequent headaches. I'm having to miss work so often. And for those patients, we will definitely talk to them about the prevention medications that are prescription.
So last time we talked about completing that doctor's discussion guide that had many of those questions on there you just mentioned. That's the way to facilitate having that discussion. And so if your quality of life is impacted, this is a good discussion to have with your provider.
Definitely.
Thank you. So for people who do not wish to use medications or to complement their acute preventative treatment plan, there are other management options with goals of enhancing personal control of your migraine and reducing headache-related distress. Dr. Chetkovich, what are some of these options?
Well, as mentioned here, cognitive and behavioral therapy, which is, understanding the causes of stress and trying to eliminate them or adapt to them. Biofeedback is another way that we can use muscle activity to help teach you how to relax. And then there are other things that work as well for some people. Things like massage, different kinds of exercises. Some people, get benefit from acupuncture. It's important to note that most of these therapies haven't been studied in great detail in nearly the detail that the clinical trials that have been used to look at the prevention medications and the acute treatment medications, but some people get benefit from these alternative management options.
So reducing stress was a big one that I heard throughout that, and using techniques to do that. You mentioned they haven't been as studied. Can you give a ballpark how effective these options are compared to regular medication only therapy?
Well, in my experience, people with chronic migraine that need intervention, no matter what the intervention is, 10 to 20% of people will respond from the first thing that you expose them to. So, and so you just keep going. What we tend to do is we cycle through these 2-3 weeks on medicine 1. And if it doesn't work, then we will cycle to medicine 2 in a different category. Instead of a blood pressure medicine, we might use a low dose antidepressant or an anti-seizure medication. People that say, I really don't want a prescription medicine, they might try the riboflavin first or the magnesium. And if those don't work, I might say, well, you can do prescription, or you can consider things like massage therapy or, acupuncture or cognitive and behavioral therapy, some other modality. So, your doctor can personalize your treatment to your needs and your budget and your, comfort with prescription medications of different types.
Nice to know there are options available.
Yes.
So let's just recap the discussion so far. Migraine management goals include reducing frequency and severity of migraines. The goals of acute treatment include treating migraine attacks rapidly and consistently. The goals of prevention treatment include reducing migraine frequency. Other management options may be used in addition to medications for migraine management. Anything else you would like to summarize or tell us about before we move on to the migraine well-being and self-management portion?
No, that's those are important things. We touched on this in the last seminar, and that is that there are certain things that you can that we know drive migraines to be more severe and frequent. And one of those things is overuse of the acute treatment medications. So all the things that I mentioned before that can help get rid of a headache when you have it, if you end up taking them on more than half of the days of the month, you can drive what is called rebound headache. And so sometimes stopping frequent persistent migraines can be as easy as stopping taking all that Tylenol and aspirin and ibuprofen and caffeine. Caffeine is a big culprit. So one of the first things that I do in patients that are considering migraine prevention therapy is to make sure that they're not overusing those medications, especially caffeine. Caffeine is a big culprit that we don't really appreciate. And sometimes stopping caffeine can change a life.
Oh, thank you for pointing that out. That's a big clarifying component of the treatment plan.
Okay, Kim, thank you. And you know, what I picked up in that section, and so far I think I am lucky enough not to have had a migraine before, but to me, it really highlights the need to have your treatment managed by a medical professional. It can be complex and a process. So, lots of good information there, and I think being managed by a professional is important. So, thanks, Kim. Now let's transition to a discussion on migraine well-being and self-management, and that's going to be led by Johnsy Holt. So take it away, Johnsy.
All right. So right now we're going to talk about the role of well-being and self-management approaches in migraine treatment. So in session 4, if you have been able to view the video, we learned about the ways that you can take migraine management into your own hands. So question for you, Dr. Chetkovich. What do you feel is the role of well-being and using self-management approaches in the treatment of migraine?
You know, I think it's really important because we know, we've talked about this before, that stress, poor sleep, irregular eating habits, all of those things can together increase the risk of migraine and the frequency and severity of migraine. So really knowing who you are and what your stressors are and trying to manage those is critical for migraine health. And so I think that this is a key component of doing well with this condition.
Great. Yeah. And you mentioned sleep, managing your stress, and healthy eating. We're going to dig a little bit deeper into those now and talk about those. So we know stress is common in a lot of our lives. And in session 4, we also learned that it can have a huge impact on migraines. So how do you feel stress is a factor when it comes to migraines?
Well, I don't know exactly why stress causes or exacerbates migraine, but it's real clear that it does. And, it could have something to do with tension of the muscles in your head and neck. It could have to do with increased blood pressure. There are a lot of changes in chemicals that happen when you're under stress and you're anxious. And it's not really clear why that will trigger a migraine episode, but it is pretty clear that when you remove that stress, you're less prone to the headaches. And so, I think that's why it's a critical thing. Right.
Yeah. In session 4, I listened to them talk about how stress is also a consequence of migraine. If you're suffering with a migraine and you don't know when it's going to stop, or you don't know when it might start again, that can be a cause of stress in life too. So
yes,
that dynamic is interesting and really important. So there's lots of approaches that we can use to help improve migraine, either through self-management or by working with a behavioral professional. So we talked a little bit earlier through Kim's discussion about behavioral treatments. So let's dig a little bit deeper into self-management. You already mentioned, getting enough sleep, regular eating, exercise, things like that. So how do you think that healthy lifestyle practices can help people improve their migraines?
Well, I think they generally reduce stress. I think that's the way that this works. They reduce stress and allow your body's normal rhythms to cycle normally. And if you get out of whack with your normal rhythms, every day has ups and downs. But if you're just always up and agitated, your brain can't relax in a way. And I think that is what triggers migraine.
That's a good point. And I know we talked last time about when we talked about migraine triggers, we talked about different foods and how sometimes that can be a trigger, as well as, not getting proper sleep. So all of these things, it's great to know that there are some things that we can kind of take into our own hands to help improve those outcomes of migraine and improve those symptoms. And speaking of stress, and those lifestyle behaviors and reducing stress. In session 4, we also practiced examples of relaxation therapies. So if you've had a chance to watch the video already, we practiced a breathing exercise, guided visual imagery, progressive muscle relaxation, as well as meditation. So Dr. Chetkovich, how do you think that utilizing relaxation therapies helps improve migraines?
Well, again, it's all about the stress. And I think that if you develop reliable ways of reducing stress and relaxing, that's really the key.
Yeah, absolutely. And we always like to have, good takeaways here. So since we're talking about stress and how important that is in managing migraines, we wanted to be sure to take this time, just a minute, to share about some of the resources that we have available through your benefits and through just different programs that are available to MNPS employees. So I'm just going to share a couple of examples of things that we have. We have lots of great resources. One of the things is if you're a Cigna subscriber, you can get the full free versions of Happify and I Prevail. Those are a couple of apps that you can have on your phone to do, short exercises or longer little programs to help manage stress. We also have a on-site fitness center, and, in the times of COVID, we are evolving and we have lots of virtual classes now. So no matter where you are, you can take advantage of those virtual classes. We currently have 18 running per week, and they are totally free for MNPS employees. So I would encourage you to check those out online at mnpshealth.org. Of course, we also have great health coaches. We have Cigna telephonic health coaching, as well as on-site health coaching, which they're doing a lot of virtual things right now as well. But our awesome health coaches like Kim, who spoke today, can work with you on your healthy lifestyle practices. In addition, we host, Dr. Shepard leads the way with our mindfulness-based stress reduction courses. We have one in the spring and one in the fall. It's total about 9 to 10 week course, and one day a week, totally worth it to invest that time to learn about that mindfulness-based stress reduction and learn the skills for it to impact your life. You can learn more about that on our website. It's mnpshealth.org. And you go to the mindfulness tab. You can get all the info there and even get on the waiting list. And then, of course, if you want to check out these relaxation therapies that we mentioned here that were in the video, you can always check out these videos again. They live on our website. That's mnpsbenefits.org/migraine sessions. All right. Take it away, Phil.
Okay, well, the first question I have is, how can I become an employee of Metro Nashville Public School System? Because you guys have it going on. If you're an employee, wow, the opportunities that you have to take advantage of are just really impressive. And so it's a fantastic tribute to, your employer and the benefits team there at MNPS. And so take advantage of that. So as we transition into the Q&A time, please just ask as many questions as you can. We have, looks like about 30 minutes left, and we promise we'll answer everyone we can get to. I know on the last webinar, I think we had to quit before we answered the last 3 or 4. We had so many, but listen, just please continue to ask questions, and Dr. Chetkovich and others will be glad to do that. So at this time, let me just turn it over to Dr. Shepard, and she's gonna lead our Q&A time.
All right. Thank you, Kim and Johnsy, for reviewing that week 3 and week 4 content from the Working with Migraine program. And now we will just move right into the Q&A. We've got some good questions coming in already. First question for you. What if you don't have a lot of warning before your migraine starts or until you really feel the symptoms? Can acute medications still be helpful for your treatment plan?
They can. We know that the earlier in a migraine attack that you use an acute treatment medication, the more likely it is to be beneficial. But it doesn't always work. And so for patients that acute therapies don't work for, or I think I see one question there where someone says they get their attacks in the middle of the night and wake up in the middle of a full-blown migraine. Those are the folks that if these headaches are happening frequently enough and they're disruptive, or you want to get treated for them, these are the folks that I would say that prevention medicines are helpful. I will say a lot of people that get nighttime migraines, they have triggers. And so really, this is one of those situations where you could work hard and try to figure out if you know what your trigger is. Sometimes it can be drinking a beer or wine. Some people, that's a trigger for them. Certain foods can trigger migraines that might manifest when you're asleep. And then, of course, it's just what time you're going to sleep and whether you're on a device right before you go to bed. That light at the last hour of the day may not be good for you. So, you can try the acute treatments. You might be a candidate for prevention medications and work really hard to see if you can figure out a trigger.
Right. So you kind of addressed this next question of waking up in the night or first thing in the morning. So we will move to the next one. Laura is asking, time permitting, she'd like to hear more about the peptide part of the migraine phenomenon and other details.
Okay. Yeah. So the way that that brain cells work is that they're electrically active. So they fire an electrical signal, and that reaches the end of the nerve cell where the electrical signal gets converted into a chemical signal. So the nerve cell will spit out a chemical onto another nerve cell or onto the blood vessels inside of your head. And when we're talking about migraine, that's what's happening. And some of those chemicals that are released can lead to changes in the size of the blood vessel. So opening and closing the blood vessel. And if there's abnormal signaling, that those chemicals that get released might overstimulate whatever the target is. And in migraine, we know that one of the chemicals that's released by pain fibers inside the head onto other nerve cells and onto the blood vessels. Those chemicals in migraine are excessive, and they can cause inflammation of the blood vessels and more pain. And one of the chemicals is a peptide. A peptide is just a type of chemical that is made by the nerve cells. And this chemical signal is a culprit in migraine for stimulating and causing more pain and inflammation. And that peptide is called CGRP, calcitonin gene related peptide. Those words don't really matter. But the CGRP, if there's too much of it, that can lead to more migraines. And so over the past decade, several new medications have been invented that will impair or reduce the CGRP signaling. They'll either grab up the CGRP and get rid of it, or they'll react with the receptor for CGRP, what CGRP is targeted towards, and it'll block the CGRP from working. And so we now have CGRP antagonists, blockers, that are acute migraine treatments, and we have another category of CGRP blockers that are chronic for prevention medications. And these are infusions that are injected into the muscle once a month, and or infused into the veins once every 3 months. And they're proven to be effective, and they help some people. So that's the peptide thing.
Yeah, interesting new class of medication.
That's right.
The next question is about that mixed pattern of headaches. So recommendations or treatment plans for people who have frequent headaches. So I'm thinking they mean like tension or run-of-the-mill headaches, in addition to having migraines, a few migraines a year.
Yeah. Well, one of the things that we know is that people who get headaches are oftentimes migraineurs, and so patients who have clear migraines with the aura, with the nausea, with the dizziness, all the things we talked about last time that makes a migraine, they oftentimes have milder headaches where they might not get nauseated and might not get visual symptoms, but they still have head pain. And it turns out the acute treatments that work for migraine also work for these other headaches that we might think are tension headaches, and not really migraines. Those treatments work for those smaller headaches. And a lot of neurologists believe that the smaller headaches in people who are migraineurs are actually migraines, even though they don't fit a classic description of migraine. So, the answer here is that if you've got that mixed pattern, treat them acutely, like you would with the Tylenol or the ibuprofen. And you could consider, if they're impacting your life in ways that you'd like to change, talk to your provider about prevention medications, because they'll probably go away with the prevention medications. Now that's different. Those little headaches that are probably also migraines are different than if you've got a sinus that's full of infection and pus. You push on your face and you've got the pain, you got the postnasal drip, allergies. And so, talk to your provider to make sure that those little headaches that you have aren't really due to something else. But a lot of times they go, if it's not a sinus headache or a different kind of structural headache, they'll often go away with treatment.
Question about hormones. Can a migraine be triggered by hormone changes like perimenopause? And if so, is treatment for it different?
Migraines definitely have a hormonal component. We talked about this a lot last time, so you can watch those videos if I think they're online. But yeah, for sure. Some people have migraines that start when they go through puberty. Some people have migraines as children and they go away through puberty and then they come back again later in life. Some people that get pregnant, their migraines go away completely. Other people develop migraines during their pregnancy. And then the same sort of thing happens around menopause. Some people who've never had migraines begin to get migraines. Most people who have migraines, menopause improves the headaches. So, different people have kind of different reactions to the different hormones. So, but yes, hormones definitely impact headaches.
And it sounds like if you make it through that perimenopause, then there's hope once you get to menopause.
Yeah, although there's always the other one that says, I've never had headaches before, now I've got bad migraines, and they're in menopause, and where are you going to go? All right, stuck.
All right, Nancy has a question about the side effects of the CGRP reducing meds.
Yeah, they have a pretty good side effect profile. Most of the prevention medications that we talked about, these infusions, they're monoclonal antibodies. So these are basically your body makes antibodies to fight infections. Well, scientists figured out how to make antibodies that block this peptide. And so those antibodies are infused into your body, they're absorbed into the bloodstream, and they circulate around and block the peptide. They don't have a lot of side effects. Because they're injected, you can get injection site reactions. You can get, if you happen to be allergic to it, you can get anaphylaxis and serious reactions. But most people, I think the side effect profile was less than 2% in the clinical trials, and that's also my experience clinically. They're pretty safe.
And you said those can be administered was it every 3-month shot?
Yeah, they're different formulations. So there are several different companies that make these, and each are different. One is an IV infusion, so you have to go into the doctor's office to get it, and that lasts 3 months. The other ones are these little injection pins that you just stick on your thigh, and the medicine squirts in, and you get another shot in a month, and you give it to yourself like you would give yourself insulin.
So would those infusions be done like in your office, in the neurologist's office?
That's right, in a neurologist's office,
Okay.
or if a provider is comfortable, it can be done in a provider's office, any provider's office that is licensed for giving infusions.
Okay, great. All right, the next question is about transient aphasia. So how prevalent is transient aphasia, the temporary inability to read or speak clearly during a migraine? Is this an unusual symptom?
Well, a lot of people with migraine get kind of a brain fog. And in that brain fog, they may have difficulty thinking, difficulty communicating, difficulty reading, following commands, that sort of thing. And so that is, it's not super uncommon, but if you're talking about a migraine attack in which, the main sort of feature of that attack is it turns off your ability to speak or understand language. It's that's called an aphasia, where you either can't understand or can't produce language. That is a concerning sign, and it's not a usual. It's a fairly rare migraine symptom. It would make what we would call the migraine a complicated migraine. If you've had many of these, if a person has had many of these in their life, it's certainly the migraine, and it's just an unfortunate side effect. But if you get aphasia, if you've had migraines and never had a confusion spell, and you've never had aphasia and you have a migraine and you get aphasia for the first time, that's a red flag to go to the hospital and definitely talk to your provider about it. That's one that I would want a neurologist to evaluate you for.
Next question is about sleep apnea. Can sleep apnea cause migraines? I seem to wake up in the middle of the night, early morning with migraines, but haven't been able to figure out any triggers.
Yes, that is another one. So not only too little sleep, but interrupted sleep. Well, sleep apnea is basically you're not getting enough sleep because you're waking yourself up by not being able to breathe in the night. And so if someone has it snores, has daytime sleepiness, falls asleep very easily, and wakes themselves up gasping in the middle of the night, that's the kind of person that I would definitely want to get a sleep evaluation, because that could be sleep apnea, and not only migraine. There are a lot of health effects of sleep apnea. So if someone has those kinds of symptoms that suggest sleep apnea, then I would definitely recommend a study and treatment.
And that was an anonymous question, but for that person, if those symptoms apply, then it sounds like it would be very helpful to you to talk with your provider and maybe get a referral for a sleep study test. Next question is, if you couldn't handle anti-seizure med side effects, so much so the pharmacist red flagged it, what would be the next step to try? Antidepressants? And we didn't talk about antidepressants role, I don't think.
Yeah, So work with this is one, I mean, I don't want to give medical advice, specific medical advice, but this is one you work with your provider or your neurologist, and just talk about the different options and the different side effects that come along with those options, and make a decision. So like I said, there are 50 prevention medications and at least 5 different categories. So there are a bunch of different blood pressure medicines. Some of them can't use with diabetes or asthma. Some of them cause severe constipation. Some of them cause water retention and your legs to swell. The antidepressants, some of them cause dry mouth. Some of them cause daytime sleepiness when you first start to take them. Some of them cause weight gain. Anti-seizure medications. Some of them cause weight loss. Some of them, there are a lot of different side effects. So it's really just talk to your provider about the different benefits and side effects. When I say, when I list these side effects, not everybody that gets prescribed those medications will develop those side effects. But when you do, you either people that I treat with different medicines, I ask about the side effects, and they say, yeah, I've got these side effects, but the medicine has worked so well to control my migraines that I'm willing to live with a little constipation, that sort of thing. So, there are a lot of options.
Yeah, and I know it can be frustrating for people to try 1 or 2 or 3 different things before they find the thing that works the best for them. But that can be par for the course, unfortunately.
Yeah.
Next question, are there any concerns about treating the sinus or smaller headaches with acute medications leading to more migraines?
Yes, I mean, that's definitely, as I said before, the risk of driving migraine is when you overuse medications. And studies have shown that overuse is chronic use on more than 1/2 of the days of the month. So if you're taking something every single day to get rid of this little nagging headache that comes every day at 10 o'clock, that may be rebound headache that you're dealing with. And so stopping the abortives for a few days and trying other things like meditation or relaxation, that can be a good option that gets rid of whatever's driving the headache. So that's how I tend to deal with that.
Okay. We've reached the end of the questions that people have typed in. I want to give anybody else on the line who has a question still a chance to type it in. But if we've answered everything, then we don't have to stay on the line. I'll just give it a few more seconds. I think we've answered everything, all the questions that people had. So Phil, I will hand that back over to you for our closing comments.
Well, fantastic. We've just had a great webinar today. Lots of really good information. So in closing, let me again thank our facilitators and especially Dr. Chetkovich for his valuable time and expertise. We really appreciate you, Dr. Chetkovich. The recording for today's session, as well as the migraine resources, will be available to you within about a week on the benefits website. And let me encourage you, if you got a lot of great value from these webinars, let Kim or Johnsy or Dr. Shepard know, or your Metro Nashville benefits folks, because this would help potentially have webinars like this in the future. So please share your feedback. So with that, thanks for attending our webinar today, and I hope everyone has a great evening, and now you can get home in time for the Titans.
Go Titans.
Have a great
Thanks,
have a great
everybody.
night. Thank you.